Knock, knock. Hello there, are you Mrs. Lane? Yes, ma'am, that's me. Good afternoon, Mrs. Lane. My name is Allison, and I'm a respiratory therapist here at the pulmonary clinic. How are you feeling today? I'm feeling pretty good. Maybe just a little worn out after all those tests I just did. Yes, ma'am, those tests can be quite tiring, but they're very important. I'm here to go over those tests with you and their results and have a conversation about how we can manage your breathing a little bit better. I understand that you were in the hospital a few weeks ago. Yes, honey, it was awful. I sometimes get short of breath, but it's never been that bad before. I'm so sorry to hear that. The doctors at the hospital said I got something called CPOD or COPD, and that I needed to see a lung doctor. So that's why I'm here. What is COPD? Is it bad? Well, I'm so glad that you decided to come in and see us. And don't be worried. I'm going to talk about COPD and provide you with all kinds of information. I'm going to make a folder for you to take home so you can keep all of that information provided to you today in one place in case you need to reference it later. COPD stands for chronic obstructive pulmonary disease. It's formally defined as a chronic lung condition that is characterized by chronic respiratory symptoms such as dyspnea, which is shortness of breath, cough, mucus production, and flare-ups or exacerbations due to airways or lung tissue abnormalities that can cause persistent and progressive airflow limitation. Oh my goodness, that sounds really serious. How did this happen? It can be very serious. It's the sixth leading cause of death in the United States and the third leading cause of death in the world. According to tests that you took today, you do have COPD, but you're not alone. Approximately 12 million adults in the United States live with COPD. And after today, you'll have some better knowledge and tools to manage your COPD and to prevent it from getting worse. Wow, I had no idea COPD was that common. It's more common than you think. The number one cause of COPD is smoking cigarettes. And actually, women smokers are 50% more likely to develop COPD. Other causes include prolonged exposure to inhaled irritants, fumes, chemicals, and dust that can be found in many work environments or areas with bad pollution. Other risk factors for the development of COPD include premature birth, frequent childhood infections, poorly controlled asthma, and then there's also a genetic condition called alpha-1 antitrypsin disorder. Oh my, I'm a smoker. I've been smoking since I was 19 years old. That's okay. It is never too late to quit smoking. About how many packs do you smoke per day? I only smoke 1 pack per day, and I've been trying real hard to cut back. I'm glad that you've been trying to cut back. That's awesome. Quitting smoking will be very important for you to prevent your COPD from progressing. Have you ever tried to quit smoking in the past? Not really. I know smoking is bad, but I never realized it was that bad. They gave me some of them patches while I was in the hospital, and they worked really good. But then, once I got home, I just stopped using the patches and I went right back to smoking again. That's okay. Quitting smoking can be really hard. And sometimes it just takes a few attempts before you're successful. You just have to keep trying. Thank you for not judging or lecturing me. That gets really annoying sometimes. It's no problem at all. I totally understand. Now let's talk about those patches again. You said that they worked well for you while you were in the hospital. Can you think of any reason why you stopped using them once you got out of the hospital? Yeah, the patches worked real good whenever I was in the hospital. I stopped using them because I did so well in the hospital, and I thought I didn't need them anymore. But then I got home, and then life happened. I got super stressed out, and I went and bought a pack of cigarettes. But I also didn't realize that smoking was probably what was causing all of my breathing problems to begin with. That's okay. There are many great resources out there to help you quit smoking. You can utilize nicotine replacement therapy, such as those patches, gum, and lozenges. And if those don't work very well for you, you can always discuss alternative options with your providers, such as oral prescription medications. Many organizations, such as Tobacco Free Florida, offer resources such as counseling and tips and tricks to help you be successful with quitting. Well, that's really good to know. I guess I could try those patches again. That's a great place to start. We'll get those ordered for you. Thank you so much, dear. It's good to know that I have help if I need it. Anytime. So let's talk about those tests that you did today. Oh my goodness, those tests. Whew, they were a lot. First, they had me sit in this booth, and then they pinched my nose, and then this guy kept yelling at me to just blow really hard, and it was exhausting. Yep, those are called pulmonary function tests, or PFTs. Oh my goodness, it was torture. Why did they make me do that? Pulmonary function testing is a test that clinicians use to formally diagnose COPD. When you're instructed to breathe in and out of that machine, it measures how much air you can get in and out of your lungs. We interpret those results, and those values are used to confirm a diagnosis of COPD and determine what stage COPD you have. Stage? You mean like cancer? What does that mean? What did my test say? So, to diagnose COPD, we look at your measurements from the test. The first measurement we observe is something called an FEV1, or forced expiratory volume in 1 second. The second measurement we look at is an FVC, which is your forced vital capacity. Both of those values are measured, and when you're asked to take a big deep breath and blow out for as hard and as fast and as long as you could, that's when we get those measurements. Oh my goodness. I thought I was going to pass out. Yes, ma'am, it can be quite difficult. An FEV1 less than 80% of predicted values and an FEV1 FVC ratio of less than 70% of predicted values indicates a diagnosis of COPD. Oh my goodness, it just all sounds so complicated. Yes, COPD can be very complicated. But wait, there's more. We also use FEV1 to stage COPD, like you were asking about earlier. An FEV1 greater than 80% is considered stage 1, which is mild COPD. An FEV1 between 80% and 50% is considered stage 2, which is moderate COPD. An FEV1 of 50%, between 50% and 30% is stage 3, which is severe COPD. And an FEV1 of less than 30% is stage 4, very severe COPD. Your FEV1 during the test that you took today was 61%, and your FEV1 FVC ratio was 64%. So according to your pulmonary function test, you have stage 2 moderate COPD. Okay, stage 2. So that's not that bad, right? Not necessarily. It's really important to remember that COPD is considered a progressive lung disease and that there is no cure for it. The best way to fight COPD is to prevent it from getting worse. And I'm going to teach you how to do that. We've already started by getting you back on those nicotine patches to help you quit smoking. You're right. I ain't never smoking again. Every patient with COPD is a little different. We take into consideration your pulmonary function test results, but we also want to assess your symptoms and determine how much they can affect your everyday life. This can help us determine what kind of inhaled medications will work best for you and what kind of additional therapy you may need. I'd like to discuss your inhaled medications. I see that you were prescribed some inhalers, is that correct? Yes, ma'am. They prescribed me 2 inhalers. I don't know the difference between the 2 medicines, though. One of them is a red one that's like a powder, and then the other one is something called albuterol or something. After reviewing your medication list, it looks like that you were prescribed a Ellipta and that albuterol is actually called albuterol. Albuterol is a short-acting bronchodilator, and a bronchodilator is an inhaled medication that relaxes the smooth muscles in your airways and helps them open up so you can breathe better. Short-acting means that that medication can work very quickly, and you may notice the effects pretty fast. But unfortunately, those medications don't typically last for very long. You'll use this inhaler whenever you notice symptoms such as tightness in your chest, wheezing, or sudden shortness of breath. And you can use this medicine up to every 4 hours if you feel like you need it. I also recommend that you use this inhaler with a spacer. A spacer? What's that? A spacer is a device that helps you get more medication from your inhaler down into your lungs. It also may prevent medicine from getting into your mouth and help with any lack of coordination when activating your inhaler. Don't worry, I'll show you with my demonstration inhalers later on. The second inhaled medication I see that was prescribed is called a Ellipta. A Ellipta is an inhaler that is a combination of two long-acting bronchodilators. This medication is considered a maintenance or controller medication. That means that, unlike the fast-acting medication, it does not work right away. With consistent usage, this medication works over a period of time to help prevent COPD symptoms. You will only need to use this inhaler once per day, and it's important to use it every day, no matter if your breathing is good or bad. Do not use it more often than prescribed. You'll notice that the Anoro is a different type of inhaler from the albuterol. The Anoro is considered a dry powdered inhaler, or DPI, and you won't be able to use it with that spacer. Again, don't worry, I'm going to show you the proper technique with my demonstration inhalers later on. Wow, I had no idea there were different kinds of inhalers. Thank you for showing me all that. Now I don't feel so lost with all these medicines. Next thing I want to discuss is learning how to recognize increasing symptoms as well as what to do when your breathing starts to get worse despite using your inhaled medications as prescribed. When your COPD symptoms such as a cough, shortness of breath, and mucus production start to increase and progress over an extended period of time, we call that an exacerbation or a flare-up. Exacerbations can be serious, and they can lead to permanent lung function decline and increase the likelihood of future, more severe exacerbations. It will be very important to try to avoid exacerbations if possible in the future. Okay, how do I do that? One way is to recognize and take precautions to avoid anything that can affect your breathing. We call these triggers. Triggers include extreme weather, allergens, smoke, first-hand smoke, second-hand smoke, or even third-hand smoke, cleaning chemicals, strong scents, good and bad emotions, difficulties swallowing, and respiratory viral infections, just to name a few. All of those things affect my breathing? Some of those things can affect your breathing. But don't forget, everyone with COPD is a little different, and what is a trigger for you may not necessarily be a trigger for someone else, and vice versa. One tool that we can utilize to help try to avoid COPD exacerbations is something called a COPD action plan. This plan includes 3 levels, kind of like a traffic light. There's green, yellow, and red. Each level will have a list of symptoms and also actions you should take when you notice those symptoms. That sounds pretty easy to understand. What does each level mean? The first level of the COPD action plan is the green level. Green means good. Green symptoms will mean that you're feeling good and you're experiencing normal symptoms. If you're experiencing normal or green symptoms, the action you will take is you'll keep taking your inhaled medications as prescribed, you'll avoid any known triggers, and you'll remain as active as possible and continue living your best life. I'm liking this green area. I love the green level. But sometimes you may start to notice an increase in your COPD symptoms that pushes you to that yellow level. The yellow level symptoms are considered warning signs of an exacerbation. These symptoms might include feeling more breathless than normal, increased coughing, increased mucus production, and your mucus may be thicker or harder to cough up than usual. That mucus may also change in color. It may be yellow or green, and you may be using your short-acting medication inhaler more often than you normally do. If you're having trouble sleeping because of your breathing, or you're having trouble laying flat, or have a poor appetite, these are also yellow level symptoms. When you begin to experience these symptoms, the action you will take will be to continue taking your inhaled maintenance medication as prescribed. You'll use your short-acting inhaler up to every 4 hours as long as it's providing you with relief. You'll get plenty of rest, avoid any known triggers, and perform deep breathing exercises. If your symptoms don't improve, contact your provider or consider going to an urgent care clinic. The red level is the serious level. The red level symptoms include shortness of breath, even while sitting still, chest pain, the inability to do any activity or sleep because of your breathing, fever or shaking chills, dizziness or confusion, or even coughing up blood. All of these symptoms are very serious and require immediate medical intervention. The action you will take will be to call 911 or to have someone take you to the nearest emergency room. Man, this action plan makes it really easy to understand when things are good and when I need to get help. Thank you so much. I'm so happy to help. Learning to live with COPD and manage it can be very confusing. Let's gather all that information that I provided you into your folder and head on over to the display area so I can show you how to use those inhalers properly. To summarize your visit today, we've talked about your COPD diagnosis, quitting smoking, your inhaled medications, and how to recognize an exacerbation. I hope you learned a lot. Thank you so much again. Now I don't feel so confused and helpless about what's been going on with my breathing.